Good morning, everyone. My name's Onyema Ibe, and I'm part of the team that were asked by the Trust to evaluate the work of the dementia projects that we're working and focusing on supporting minority ethnic communities. And I'd like to talk a little bit about some of the research that we carried out and what we found. So we've already heard from some of the work carried out by REACH, and I'm just going to remind you about the full funded projects. In the north, Aberdeen Council of Voluntary Organisations, ACVO, targeted their funding on developing and producing toolkits, one to assist the European ethnic minority community and the other for those providing dementia services. In Lothian, the Minority Ethnic Carers of Older People project, MECOP, focused its funded work on awareness raising amongst the Cantonese-speaking Chinese community and providing intensive support to some individuals with a dementia diagnosis or suspected to be living with dementia. In Glasgow, as we've heard, REACH supported individuals and families from the South Asian community through the dementia-friendly group and dedicated support to some families from a dementia link worker. And in Forth Valley, Central Scotland Regional Equality Council, or CESREC, worked on awareness raising about dementia amongst a wide range of minority ethnic communities across their area, and also worked with dementia service providers to understand how to make their services more inclusive. So what were we asked to do? The Trust asked us to look at the work of the full projects and consider what they'd done, how they carried that work out, what had been achieved and what had been learnt. And we did this by looking at the data that was gathered, speaking to the project staff and volunteers, talking to those people who had used the service from a minority ethnic community, and also those people and organisations that had been helped by the project either through referrals or supporting or building their awareness. What did we find? Well, we found that there was increased engagement for working with people from minority ethnic communities. 3 of the projects worked with individuals, families or community organisations to provide intensive support or guidance. REACH, as we've heard, had the dementia-friendly group, and they also undertook home visits and telephone support to some families through the work of the link worker. In MECOP, the dementia support worker guided individuals and their families through the dementia diagnostic process, attending GP appointments, assessments, and other appointments to provide language and emotional support. In CESREC, their project engaged with a wide range of minority ethnic community groups in order to raise awareness and increase understanding of the barriers that communities faced when accessing services. We also found that there was increased awareness and opportunities to challenge perceptions of dementia within communities. All 4 projects delivered awareness raising activities to help address some of those misconceptions and reduce the stigma about dementia amongst communities. ACVO developed a toolkit that provided general advice and practical guidance and local information about services for people affected by dementia. The resource is available in Polish, Russian, Spanish and English, which reflects their focus on European minority ethnic communities in Aberdeen. The main aim of CESREC's project was awareness raising, and they engaged community groups through tailored sessions to improve understanding of dementia and provided information to help deal with emotional and practical issues, with information like the rights of unpaid carers. They also produced an information booklet for people living with dementia. At MECOP, the dementia support worker delivered awareness raising sessions in Cantonese, providing an overview of dementia from recognising early symptoms through to post-diagnostic support that was available in the Lothian area. And REACH offered care information courses in partnership with Alzheimer's Scotland, again covering topics like understanding dementia, communication, behaviour, and the services and support that was available. So across the 4 projects, there was a real increase in awareness of dementia within the communities. We also found that the work of the projects increased the number of culturally relevant services. The projects delivered new services that were relevant for the people and the communities that they were supporting, and produced resources to help others to do this. So ACFO, we've talked about the toolkit for communities, but they also produced a toolkit for practitioners to help them to deliver dementia services that can more effectively support people from minority ethnic communities. At MECOP, the dementia support worker provided a language and emotional support service to those individuals and families from the Cantonese-speaking Chinese community, so that the services then became more accessible and more culturally relevant for those people that she was supporting. At REACH, the link worker also improved the service that some families accessed by the intensive support that she provided. And at CESREC, that project built strong relationships with a wide range of support services across the Forth Valley area, liaising with them to share information on how to best tailor their dementia services to reduce the barriers for people from minority ethnic communities. We also found plenty of information about what the needs are and what the issues are in terms of accessing services and general awareness about dementia. Each of the 4 projects documented the challenges faced by the people that they supported, and this is summarised in the report and looks at those barriers and challenges at each stage in the dementia pathway. At pre-diagnosis, there are a number of common challenges, which included those that relate to communities themselves around reluctance to acknowledge dementia and the symptoms, concerns about people knowing about the condition, and a general mistrust of the health service. A diagnosis stage, a GP and hospital settings rarely provided language assistance so that individuals couldn't fully engage in the discussion about their health. And even when interpreters were available, there was often a gap in understanding between what was simply interpreted but not necessarily explained. But crucially, what was evident at the diagnosis phase and in all stages of the pathway is that many of the methods rely on fluency in English, which prevented full participation in any assessment for those individuals from a minority ethnic community where English wasn't their first language. At the care and treatment stage, access to care and treatment presented more challenges for some people from minority ethnic communities. Again, there was a general lack of awareness of services that were available, and where services were available, staff often lacked the cultural competency to deliver an appropriate service, or could not address sensitivities around, for example, gender-specific requirements, or even offer care from a staff group that reflected the communities that they worked with and supported. Once diagnosed, everyone is entitled to post-diagnostic support. And even when individuals from a minority ethnic community were aware of this support, the services rarely had multilingual staff, and access to them was again geared towards the English-speaking majority. So the evaluation highlighted plenty of learning, plenty of opportunities, and the development of an increase in services that were available for certain communities in those areas where the projects were working. And later on, we'll talk about how that has informed the recommendations in the evaluation report. This morning, we've heard about the work of the projects, and the evaluation team used the learning from this work to identify recommendations for the final report. These recommendations aim to support and improve current and future dementia services so that they're more appropriate and accessible for people from a minority ethnic community. I'm going to talk for a few minutes about these recommendations. As we've heard, the projects have an established presence in their local or regional areas. and there is now an opportunity to build on their work and further increase the awareness and understanding of dementia amongst minority ethnic communities. This would then support people to better understand what support and care could be needed and what was or could be available for them to access. So the first recommendation in the report is that the projects and other representatives within minority ethnic communities should continue to work to improve understanding and awareness of dementia and the services available. Building on from that first recommendation, with individuals and community representatives that have an improved understanding and awareness of dementia and the services, if there was more effective engagement between service providers and minority ethnic communities, there would be increased opportunities to work together. This could lead to better understanding of the challenges, opportunities to test out solutions, and consider the most appropriate way to provide more relevant services. So recommendation 2 is that service providers should build meaningful partnerships with minority ethnic communities and organisations that work with them to better understand their local communities and work together to design appropriate services. All 4 projects identified that the most notable challenge was the lack of cultural appropriateness and understanding within mainstream services, which prevented access for many people. From this work, we've talked about the awareness raising materials that were created for providers, and those resources, together with closer working with people from minority ethnic communities, will support providers to make the necessary changes to services so that they are more inclusive. The third recommendation in this report is that diagnosis services and care providers should improve the cultural competence of staff and volunteers so that the services they provide to minority ethnic people living with dementia are culturally sensitive and appropriate. When I talked earlier about some of the barriers to services, these do overlap with those faced by the general population, but for people from a minority ethnic community, they are heightened, more complex, and in abundance. We've heard about some of those today, examples like language barriers, misperceptions, inaccurate translations, and lack of cultural awareness. So key decision makers developing local responses to dementia services and care have a responsibility to address these challenges and widen access and improve the service experience for people from minority ethnic communities. So the final recommendation in the evaluation report is that as part of the development of local dementia strategies, decision makers in those organisations like integration authorities should acknowledge and address the needs of people from minority ethnic communities when they are identifying and designing their services and priorities for their local population. I hope as we now move into the breakout groups, we can discuss these in more detail and consider what we can do to help make these changes happen. Thank you.